and follow the instructions outlined. Digital vaccination cards are here. Get your vaccination card today. Get vaccinated. Get back to life.
Booking your COVID-19 vaccination appointment is simple. Use one of two options. Option 1. Register using the online portal at the Ministry of Health and Wellness's website. Go to www.mo.gov.jm, click Apply here for COVID-19 vaccine, and follow the instructions on screen. Enter your mobile phone number. You will receive a text message with a one-time password. Enter it on the site to confirm your account. Fill in the information requested. Choose your parish and a vaccination center there. Then schedule a date and time convenient to you. You will receive a text confirmation with the details of your appointment. Option 2. You may also book your vaccination appointment via telephone. Call the National Vaccination Center at 888-1-LOVE. That's 888-663-5683. A representative will take your information, book you at the nearest vaccination site, and register your appointment. You now have a vaccination appointment. For your first dose, when going to the site, take your TRN and a government-issued identification or letter from a Justice of the Peace. For your second dose, take to the appointment your vaccination card, TRN, and a government-issued identification or letter from a Justice of the Peace. You may ask a relative or friend to help you book your vaccination appointment. Book your COVID-19 vaccination appointment today. Get vaccinated. Get back to life.
COVID-19 is still here. Always wear your mask correctly while in public places, covering your nose and mouth at all times. Masks should never be worn over the head, under your chin, below your nose, or hanging from your ears. Recovery from COVID-19 can take up to 60 days or more. The mask or the ventilator? You choose. A message from the Ministry of Health and Wellness.
The point of wearing a mask is to prevent the spread of air droplets from persons who may or may not be infected. When wearing a mask, please ensure that the mask goes above the nose and below the chin. This might be a bit uncomfortable, but it's for your own safety. The position of the mask is very important. It should not be worn on your forehead, under your chin, or on your neck. Please do not remove the mask when speaking. This actually causes more droplets to be released into the atmosphere. Trust me, if you have on a mask, we will still hear you. When you're removing a mask, try not to touch the front of the mask. If you do, remember to wash your hands or use hand sanitizer. Please throw away the mask appropriately. Remember, partial protection is better than no protection.
Evening, ladies and gentlemen, members of the media. Happy New Year, and thank you for joining us for the Ministry of Health and Wellness's COVID conversation for Thursday, January 6, 2022. The Minister of Health and Wellness, Dr. the Honorable Christopher Tufton, is joined by the Honorable Favour Williams, Minister of Education, Youth and Information, Mr. Shane Dalling, Acting Board Chairman for the National Health Fund, Mr. Dunstan Bryan, Permanent Secretary in the Ministry of Health and Wellness, Dr. Jacquiline Bisasor McKenzie, our Chief Medical Officer, Dr. Melody Ennis, the Director of Family Health Services, and Mr. Sean Bolton, our ICT Lead at the Ministry of Health and Wellness. We'll begin this evening's conversation with the update from the Minister.
Thank you very much, Stephen. Good evening, everyone. Good evening to my colleagues, CMO, PS, those online, including and especially welcome to my colleague, Minister Favour Williams, Minister of Education, who I'm sure will comment later on as it relates to schools and some of the concerns as it relates to the return of face-to-face session. Mr. Shane Dalling, Acting Chair of the National Health Fund, is on. because they have some issues should the public need any further information. And I believe Mr. Sean Bolton, who heads up the digital vaccine system, is also on. So we have a fairly packed agenda. We'll go right into it. In the last 24 hours, Jamaica, that is, we hit an undesirable record of some 1,128 new COVID-19 infections since the first case was discovered close to 2 years ago. So it's the most in any given day, in keeping with the fourth wave, which we are now experiencing. We also recorded 3 additional deaths, and our condolences to those who have been so affected. This brings the total number of recorded infections to the island to 98,194, and to 2,486, the total number of deaths to date. We also have some 372 persons hospitalized, 204 positive for COVID-19, and another 168 suspected. So do have some increase in hospitalization between confirmed and suspected cases. Of those positives, 39 are moderately ill, 23 are severely ill, and 3 are critically ill. 32 of the 35 who are moderately ill are unvaccinated, while 19 of the 23 who are severely ill are unvaccinated. And all 3 persons who are critically ill are unvaccinated. And we wanted to add this segment of the assessment because we need to continue to emphasize to Jamaicans that the persons who are most affected by COVID-19, irrespective of the strain, whether it's Delta or otherwise, are the persons who are not vaccinated. And it is a sobering message to those who are not that you're in increased danger and you should make every effort to get vaccinated. Meanwhile, up to 5 p.m. today, we had administered some 977 doses of vaccines at 977 doses. That's 977 doses. 202,000 first dose, 501 and 32,000 doses, second doses, so 500,000 approximately persons are fully vaccinated. 76,783 single dose Johnson & Johnson. So if you add the 76,000 and the 500,000, you're talking about 580,000 Jamaicans fully vaccinated, and 1,588 immunocompromised doses, persons who have gotten a third AstraZeneca dose because of their compromised immune system, and some 7,372 booster shots administered to date. I would like now to invite the Chief Medical Officer in our usual approach to provide a more comprehensive update on what is happening in the country as it relates to COVID-19 and the fourth wave.
Good afternoon, Minister P.S., and good afternoon, everyone. So our update is as of the 5th of January, 2022. So we are now at 98,194 confirmed cases, having confirmed 1,128 new cases yesterday. This brings our daily positivity was 46.8%, and the 7-day average 38.7%. We're now at 2,486 deaths. So far for 2022, we have had 5 deaths reported, and our case fatality rate is therefore at 2.5%. In terms of age distribution, a lot of persons have been wondering whether or not we are seeing increased numbers of children that are affected. In terms of proportional increase in the types of cases, in terms of age, it remains pretty much the same. But because we're seeing more cases, we certainly are seeing more persons in each age group. But proportionately, it remains the same as it was before, in terms that we're still seeing the largest number of cases coming out of the 20 to 39 age group. Next. So this is looking at the age distribution by wave period. So we can see that in the third wave, if we follow, first we have the first block is the pre-community transmission. Then we have wave 1, followed by interwave period, wave 2, then an interwave period, then wave 3, an interwave period, and wave 4. And we can see that the purple section represents the children under 18 years, and we can see that that number has not really increased. Proportionately, it remains about the same, even slightly less than what we had in the last wave. However, the 18 to 39 age group, the blue area, is where we're seeing the increased number of cases. Unfortunately, if we look at the green area, we can see that the 60 and over age group, we have less persons, less proportion of persons being affected in this age group. Over the last 14 days, we would have confirmed 4,863 cases across the island. Next. And this would be in 438 communities out of 783 communities across the country, which represents a very high level of geographic spread. We are now at 55.9% of communities are affected by COVID cases. Here we look at the admission rate in hospital, and what we can see is coming out of the third wave that we were decreasing quite considerably, and then over the last 2 to 3 weeks, we have seen an increase in the number of cases, where you can see in the pink line, the increase in the number of admissions per week, and we can see that that follows the number of confirmed cases in the blue. Also, we would have seen here that the number of deaths would have declined quite considerably after the third wave. Now, we're in the first part of the fourth wave. The fourth wave started about in the 20th of December, and we would have seen the increase in the number of cases. However, what we will see is that bed occupancy and deaths don't normally go up at the same time. We would see a 2-week period where we would then see if we're going to have an increase in deaths. That is when we would see that. So right now, we're not seeing an increase in the number of deaths. That still continues to go down, even though we're seeing a small increase now going up in terms of admissions and bed occupancy. And here we can see the bed occupancy levels going up again. So over the last week, we would have seen that we would have gone up to 300 to 400 beds being occupied, coming from we were down below 200 for a little while. And the reproductive rate is going up, and we see a big jump in the reproductive rate. Remember that we were below 1 for quite a number of weeks, and now we can see using the confirmed cases to calculate the reproductive rate, we are now at a reproductive rate at 2.4. That is a big jump, and what it means is that if the reproductive rate continues along this line, then we are going to see a very rapid increase in the number of cases. And this is reflected in the positivity rate that we see here, that it is going up. Next. So in terms of vaccination, and the best protection against COVID is still vaccination. And we can see that in the number of deaths that we've had between the 1st of March up until 2021, up until now, the 5th of January 2022, we've had 1,953 deaths, and of that, 98.5% of persons have been unvaccinated, meaning have not received either the partial course or the full course of the vaccine course. So vaccination is offering a very high level of protection to our population. And this is just one way of showing that it is best to be vaccinated now. And looking at the vaccination program, we're still at a low level of vaccination. The total number of doses administered is 1.2 million, 18,281 doses. And of that, first doses that are administered, 639,642. Second doses, 496,298. And we've had 76,000 persons who have received a single dose. And Minister has already spoken about the numbers that have done the extended series and the booster doses. So still, we're seeing that 74% of our population has not been touched by vaccination. And we have shown the value of vaccination, showing that the deaths are occurring in the unvaccinated persons. It is the unvaccinated persons that are ending up in hospitals with severe cases of COVID. And this is our vaccination coverage by age, and really want to point out the 60 to 69 age group and above, 70 to 79 and the 80 plus. It's very, very important at this time that we move these numbers up to protect this vulnerable population from becoming ill with COVID. Right now, we have just over 40% of the 60 to 69 and 70 to 79 who would have received either 1 or 2 doses of the COVID vaccine, which means that almost 60% of persons in these age groups have not received the COVID vaccine and therefore remain quite vulnerable. With the numbers going up so rapidly, it is very important that we get these persons vaccinated urgently. We need to push those numbers up so that we can protect the population. So in summary, in terms of the geographical spread, we now have 55.9% of communities affected. In terms of bed occupancy, going back up again, very high pressure on the hospital system. Several hospitals now have to be considering changing the service delivery by curtailing some activities to be able to manage the beds, the COVID beds. We have a very high 7-day positivity at 38.7%, and we moved very, very quickly from 5% to this kind of numbers very, very quickly, a very, very sharp increase in the positivity rate. And the reproductive rate, 2.4, very high compared to where we were a couple of weeks ago. And still our vaccination level is below 30%, at 21%. We need to get that up urgently. In terms of what can we expect with this increase that we are seeing, certainly we are seeing right across the world that with the Omicron virus, it is proving to be a more transmissible virus, and so the numbers are rapidly increasing in several countries. And we have started to see that here. And based on the projections using the reproductive number, it could mean that we may take another 3 weeks or so to get to the peak of our this fourth wave. And in that peak week, we could have as much as 11,500 cases being confirmed based on the present numbers where we are and the reproductive rate. Rapid exposure is happening to a lot of persons, and the numbers are going up quickly. And so with so many persons becoming infected, what it means is that in the peak week, we could see an increase in the number of deaths. The number of beds occupied could go way above the 1,200 where we were in the third surge, and could go up to almost 2,500 persons on beds. Next slide. So this is looking at the projections again in a graphical way, where we can see that the confirmed cases are going up, and if we follow that trajectory, then we have a lot more that we are going to go to reach up to that 11,500 in that peak week. And in terms of deaths, the trend is there, again, showing that increase, that we can have that possibility of rising in numbers. As the number of confirmed cases increase, the number of deaths can also increase to in the region of 200 to 300 in that peak week. And again, in terms of hospitalizations, again, the trend is up. Next slide. And in terms of seriously ill patients, again, the projections are showing that the numbers are going up. Next slide. Next slide. Okay. Next slide. So this is just looking at the hospitalization, the cases in hospital, and we can see that we're starting to see the lines going up in terms of the moderately ill in blue. Those are the larger numbers that we're seeing. Persons who are moderately ill are taking up the larger numbers in hospital. And then we have the severely ill that are going up, but not at such a fast rate. And thankfully at this time, we're seeing the critically ill in gray, that the critically ill we're not seeing that increase as yet. And this could be directly as a result of the vaccination and the fact that we have vaccinated a number of our elderly persons. And again, the others need to be vaccinated because we need to keep that critically ill set of persons down. Next. And in terms of our utilization of oxygen, when we look at the number of persons who are on mechanical ventilation and the number of persons that are on high flow nasal oxygen, both type of therapies are used in severe and critical COVID and utilize quite a bit of oxygen. And we can see that while it is that the numbers are going up slowly, that the number of persons on mechanical ventilation have not really been increasing as yet. And so we are hopeful that we will not see that going up. Next slide. And in terms of the number of persons on high flow nasal oxygen, we're also not seeing that going up as yet. And so again, we're hopeful that, we will not have so many of severe and critically ill persons. In terms of children, so we would have shown that proportionately the number of children has not really increased, but simply because there is a larger number of persons, that proportion is larger. So we are seeing an increase in the number of children in hospital now, and you can see this on this graph where the number of children in hospital is getting to be higher than we have ever had before if it continues to increase. So this is something that we have to watch carefully and remember that the children are getting, will get COVID from the adults who can be vaccinated. So the protection of the parents and the persons in the home through vaccination will prevent the transmission to children. And so therefore, vaccination is key here again. So in terms of daily hospitalizations, again, you can see the slow movement up. Started the 7-day period at 250 persons occupying beds and ended the 7-day period at 442. And we can see that the number of admissions per day going up. Started the 7-day period with 55 admissions for the day, ended the 7-day period with 66 admissions per day. Next slide. In terms of the hospitals, how they're looking, the COVID beds are slowly going up, but not at a point where it is critical at this point. But certainly in terms of the general admissions to hospitals, we are seeing that there are quite a number of our hospitals, especially our larger hospitals, all our regional hospitals and our type A hospitals are at red alert in terms of over 84% capacity. So we don't have a lot of capacity to manage several persons being admitted. So next slide. So the advice, of course, to persons is get vaccinated and to adhere to all the infection prevention and control measures. You have to wear your mask, maintain physical distances in crowded spaces, 6 feet if you can, wash your hands frequently, hand sanitize, stay home if you're sick. We're still seeing that wherever it is that we have cluster of cases, it turns out that somebody who is sick did not stay home and spread the infection in workplace and in other areas. Stay home if you are sick. Avoid unnecessary travel at this time. The traveling situation is very, very finicky at this time, and there are a lot of changes that are occurring. So if you can stay home and avoid unnecessary travel. And certainly avoid unnecessary gatherings at this time. Over to you, Minister.
Thank you very much, CMO. So there you have it, folks. In her usual style, she has provided very important technical information so that we are totally transparent in the COVID response and the state of COVID in the population. Just to reinforce a couple of points quickly before we touch on our schools and invite the minister to speak briefly. Positivity rate, reproductive rate, 2.4%. Now, I want you to understand what that means. It means that under normal circumstances, we would desire a reproductive rate below 1, and well below 1, maybe 0.5, 0.6, maybe 0.7. At 2.4% means that the virus is expanding exponentially. It means at this rate, we're likely to see significant increases every 2 days, 3 days maybe, doubling of the numbers possibly, unless we cauterize the spread of the virus. And I think it's very important to lay that out very clearly to Jamaica and to Jamaicans. A 40+% positivity rate, 7-day average, 5-day average showing over 40%, over high 30s, over 40. But the reproductive rate is what needs to be watched. Now, I say that to say the following, because I've heard a narrative, many who claim to be experts, maybe they are, clinicians, non-clinicians, and others, advocating a level of comfort because of this variant strain and the fact that this strain is the great vaccine that will cure all of us and bring an end to COVID. Maybe it will. Maybe it will. But I caution us as a country, as a people, to not become complacent with that narrative and not observe the critical protocols that are being proposed, that are contained within the Disaster Risk Management Act, and that the ministry has been encouraging us to maintain: the mask wearing, the physical distancing, the sanitizing, and of course vaccination. We have to look at the spread and the rapidity of the spread and contextualize that within the challenges that we face as a country. We're not a developed country with unlimited resources, unlimited hospital beds, and even in those countries, those hospitals and hospital beds are being overrun. We have a vaccination rate that is lower than many of these countries. The US is 60+%, and they are being overrun in some states. This is not a Jamaica problem. It is a global problem. This new variant strain, the virus, is raging in countries that, on the face of it, have a lot more capacity in terms of doctors, nurses, hospitals, facilities, and many people are dying. And so I urge us as a people and those who comment and are influencers in the society not to create a false sense of complacency and security because we have all concluded that this strain may be a less severe strain, because there is a direct relationship between the extent of spread, the unvaccinated and the vulnerable, and those who will end up in hospitals. And it is very possible at this rate that our redundancies, our capacity in terms of beds and people can be overrun if we continue on this trajectory, even with the lower rate of hospitalization. I just feel that I need to say this because I hear it every day, almost as if, okay, everything is all right, because this is not so a problem. The second point I want to raise is that I've advocated, and I'm becoming stronger in advocating for this. Personal opinion, but obviously I think the Honorable Prime Minister is there and he has advocated on behalf of the Cabinet and the government around the vaccinated and the unvaccinated. And he did it well 2 days ago at a worship service in Portmore where I was present, where he drew the distinction between those who are vaccinated and those who are unvaccinated. And I have said too, in keeping with that same thought, that there are unfortunate disadvantages that are placed on the vaccinated by the many who are not vaccinated. And people question that, given that the virus can spread whether you're vaccinated or not. Well, I'll tell you, for starters, low vaccination rates affect productivity in the country. This high level of positivity has impacted work flow and work participation. It affects hospitalization. And in a case where you have low numbers of beds, you have to adjust priorities. So the person with hypertension or cardiovascular disease or one who needs a hip surgery have to then play second fiddle to a serious COVID case because you have to prioritize. And of course, it affects the extent to which people have to restrict themselves, whether because of the Disaster Risk Management Act or because of their own personal concerns about themselves. So, to my mind, one should appreciate and understand that those who are vaccinated have taken the responsible decision, and those who are not have not done so. And I believe, again I say, that the time is now to recognize and celebrate those who have, but to frown on those who have not. And if it means screening in terms of access to your personal space, whether you're home or your special event or at the workplace, I believe we need to get there, because Omicron may be milder, but more people getting it will mean more people being affected and all the other related impact that it will have on the society. And then the final point I want to raise is that we have to draw a distinction between the vulnerable who are of a particular age and the rest of society. So the over 60s, the immunocompromised, we say let's target them, and I agree. And we are making an effort to target that group who are most likely to end up in hospitals. But we also have to recognize that those who are younger in age will impact those who are older and more vulnerable. We are an extended family society. So children, younger people visit their mothers. There are big homes with multiple generations. And again, we have to contextualize. So the message has to be across the board, even while we target those who are most vulnerable. As our children return to face-to-face classes this month, and with the increase in our case numbers, it is important than ever that we redouble our efforts to live successfully with the COVID-19, despite the risks. Our children have suffered many hours of learning loss, even as some among them have experienced mental health challenges associated with being away from trusted teachers and friends. It is necessary, therefore, that we apply the many lessons learned from the COVID-19 experience over the last couple of years to support their return to face-to-face class discussion. A bold decision by the government, but I believe the correct decision, because the opposite to that is restriction, and the impact on our children is severe and has been severe. Those lessons include that vaccination and infection prevention and control measures, mask wearing, hand washing, sanitizing, as well as physical distances distancing can work to minimize the spread. Testing has also been an important tool helping to contain the pandemic as infected persons are identified, interventions made to prevent transmission. As part of those efforts, today we handed over the Ministry of Health 5,000 self-test kits or home test kits to the Ministry of Education, Youth and Information. And this is part of our strong collaboration working with the Ministry of Education to ensure that we not only return our children to face-to-face, to get them back on stream, to build their capacities and prepare them for the future that they deserve, but that we also do so in the way that minimizes the risks. So we have online today my colleague Minister Fable Williams, and I'm now going to invite her to just give a few words, since there has been a lot of concerns raised in terms of what is happening in our schools and how we are working together, and she's doing the hard work to ensure that our schools are safe. Minister Williams, welcome.
Sure. Thank you, Minister Tufton. Let me acknowledge you, the CMO, Dr. Bisasor McKenzie, Dr. Ennis, Chairman Shane, members of the media, Jamaicans all. I appreciate the opportunity to be here this afternoon to speak about what we are seeing in terms of the return to face-to-face in our schools as we learn to live with the many variants of the COVID-19 virus. Based on the reports, I can say that our schools are adhering to the COVID-19 protocols. We see this in the mask wearing, we see this in the physical distancing in the classrooms. All of our schools have wash stations that are visible. There are signs in many places reminding children to wear their masks, to do physical distancing, and to continue to remember to wash their hands as many times as they can. As you know, the Easter term of this academic year started on Monday, and we started out with some 608 of our schools, which is roughly 61%, reopened for face-to-face engagement. This is a continuation of our process of bringing our children or students back into the face-to-face environment. We would have started with the face-to-face engagement from November of last year. At that time, we would have brought back the early childhood sector or small primary schools or medium-sized primary schools, and then we added our large primary schools. We also last term had our grades 11, 12, and 13 students in the high schools back in the face-to-face environment. So this term, we are adding the grades 7 to 10 students in the high school back into the face-to-face environment. So far, what we've been seeing, this is the first week of school. Again, a majority of our primary schools are in the face-to-face mode as compared to the high schools. We've only seen maybe 30 or so of our high schools back. They have chosen this week at least to be online. The majority of schools have reported no issues. As customary, they are staggering their opening activities, and those opening activities would include orientation, resensitization sessions, professional development sessions, planning sessions, psychosocial and motivational sessions, and a few schools have reported that they have commenced their examination sessions. Some schools are opened for the entire day, depending on their capacity relative to the number of students that they have, while others are using the rotation method, meaning they will have some students in the classroom on one day, others at home, and then they rotate so that by the end of the week, every student would have gotten at least 2 days in the face-to-face environment. 92% of our schools have been approved by the Ministry of Health and Wellness to be opened. And what I mean by that is there is a requirement from the Ministry of Health and Wellness for our schools to be re-inspected. So the Ministry of Health and Wellness would have physically inspected all our schools during the past school year. but they've given us a requirement again to have those schools re-inspected. So they send inspectors in to look to make sure that there's proper signage, there are wash stations available and they're visible, that the school has an isolation center. They look at it, ensure that bathroom facilities are there, and it's only available for the isolation center. They look in terms of the classrooms to see how many desks are laid out in the classrooms, and they'll examine as well non-COVID related issues. Identify termites, then that will go on the report, and we have to take action to fix those things that they observe as being out of line before they would give the satisfactory rating to the school. They have been working overtime to inspect our schools, and where we are now, about 92% of our schools are approved by the Ministry of Health and Wellness. For the others, there are some maintenance work that needs to be done, and we're doing those. During the week, like I said, the majority of schools reported no issues, but we did get reports from a few schools who told us that in some instances, there were a student or two at their particular school who didn't show up but reported flu-like symptoms. In one school, they reported that their principal was COVID positive, and so that principal remained at home. There was a teacher who reported that he or she was in quarantine and remained at home. For the most part, the issues that were reported to us, those persons remained at home who were seeing symptoms, and that is the right approach for persons to take. If you're seeing any symptoms at all, to remain at home until those symptoms work themselves out. Of course, we'll continue to work with the schools on whatever non-COVID related issues that they're seeing to ensure that all our schools are able to have some face-to-face for our students. So I would have, while I was speaking, I note that there were a few pictures showing, and we just wanted to show you what it looks like in our schools when we talk about the physical distancing. Schools do adhere to that. That's Orange Hill Primary School, grade 6. This is a mass break that the students are taking. You can see they're well spaced out. We note as well when students are coming into the school, there's a requirement for temperature taking and so on. Our school leaders who are on the ground, or principals, they are very aware of the restrictions and all the rules. And in terms of our monitoring and observation and the reports that we're getting, we are seeing good adherence to the COVID-19 protocols. In general, principals, parents, students who are back are happy to be back in the face-to-face environment. You will note that many schools are using the blended approach, so they are beginning to bring more technology into the classroom as well. And for those schools who are able to, they can have a teacher in the physical environment while students who are home can zoom in to the class and be connected that way. So we will continue to monitor the situation, of course. I know I have a direct line to Minister Tufton in terms of any observations from the reports that we get, and we will continue to report to the Jamaican people what we're seeing as a whole across our schools across Jamaica. Thank you.
Thank you very much, Minister. And I hope you'll spend a little more time with us, because we do have a question segment which may come in another 10 minutes or so. But thanks for that. Appreciate it. And I'm sure the public appreciates the ongoing updates. As predicted, ladies and gentlemen, the fourth wave of the pandemic is here. We have said that a few times. The evidence is in the increased cases, as was announced earlier, over the past 2 weeks. More COVID-19 infections invariably means, as I said, more hospitalization, which will put some pressure on the public health system. We just want to remind the public that we have put measures in place and have been putting measures in place to deal with it. It's not an indication of an encouragement to be complacent, but we want to know and to reassure the public that we are not oblivious to the need to prepare, and we certainly have an obligation to treat with all who are affected and whose life is in danger, in jeopardy. And so I just wanted to quickly go through vaccination. We continue as the most effective response to champion the vaccination program by firstly providing outlets 250 access points up and running with boosters on offer. I just want to say that I did my booster yesterday at Spanish Town Hospital, yesterday afternoon. I want to thank the team at Spanish Town Hospital. I took all 3 shots at Spanish Town Hospital, very effective team, and really appreciate it. That's my parish of constituency, West St. Catherine, West Central. And I just want to recognize them for the efforts. Thank you for that. But we do continue to encourage persons, and I agree, the elderly to get vaccinated. They are the vulnerable. But everyone, because we all commingle and intermingle because of the features of our society, and it is so important. But particularly to those who are immunocompromised, hypertension, diabetes, the vaccines are available. We have vaccines in stock, vaccines that are safely stored and are available. All the brands, AstraZeneca, Pfizer, Sinopharm, Johnson & Johnson, those are the vaccines we have, and they are available. We had a little issue with some of the logistics around the AstraZeneca over a couple of days ago, but that has been resolved, and AstraZeneca should be now in the system right across the country. So there is no excuse. Visit your parish health office or call the 8881 number. In terms of increased opportunities for testing, in addition to the Ministry of Education, we have also made an initial donation of 5,000 home self-kits to the Jamaica Hotel and Tourist Association for tourism workers. We'll give another donation to them. There is also ongoing work with the Jamaica National Agency for Accreditation to certify additional labs to offer testing for COVID-19 persons who would like to be tested. So the JANAC, which is under the Ministry of Industry, Investment, Commerce, as well as our National Public Health Lab are working together and certifying testing sites to provide a range of possibilities, plus the self-test kits, which we have approved at least 3, I think, importers, and subject to their importation, they will be available across the country for persons to purchase. But we do advise that this is not a substitute for other tests. It is perhaps the least accurate. A lot depends on how it's administered. And if you get a positive or if you have symptoms, we certainly advise you to visit your doctor, your health center, or to do a PCR test. Oxygen, we have been given assurances by our main supplier of medical oxygen that we can support a surge capacity of up to 1,200 patients in COVID-19 beds. We're looking at diversifying our supply of oxygen, as we have said, including through public-private partnerships. And last month, the Honorable Prime Minister, we thank him for that, gave through his Positive Jamaica Foundation donation of 19 oxygen concentrators to the Ministry of Health and Wellness. And that is an indication of the public-private partnerships, but there are several others. And we want to thank the Prime Minister for that. Staffing, temporary staff employed to support the operations of our health facilities, and the rollout of the National Vaccination Program has had their contracts extended to March this year. So our staff that were temporary are intact. Is it 1,500 approximately? Approximately 1,500 temporary staff. It is to be noted that we have begun to receive notification, unfortunately, of absenteeism from the regional health authorities concerning some doctors, some nurses, and other medical, clinical, or clerical and administrative staff within our health facilities who have to be placed in quarantine and isolation. So the rapid spread, the fourth wave, is also impacting our staff. We're monitoring that situation. It does lead and would lead to some slowdown in some areas, so we ask persons to be patient. But if our frontline persons are affected, we have to protect them. We have to get them to recover so that they can go back on the front line. And so we are observing that situation closely, and if there is an extraordinary circumstance, I'm sure the local management will make the adjustment as necessary. It does, however, affect outpatient clinics and elective surgeries, which is concerning, and comes back to my point of the links between the unvaccinated, who are the ones that are hospitalized, and its impact on elective surgeries and outpatient clinic. It's very linked, which is why we have to frown on those who are not vaccinated, because they are letting us down. And it's an important point, and I'm sorry, but I'm prepared to offend by making this, but I think it's important to make that point. COVID-19 beds, final of 8 field hospital is to be completed this month at the Savannah Lamar Hospital, increasing the bed capacity to some 745 island-wide. You would have heard the information given earlier on those beds and what we have. So this is just to give an indication that we have a plan, and we are anticipating that that plan has to be executed. And we do have some experience, having gone through 3 waves, to execute that plan. This is the most aggressive growth pattern that we have seen. So there is some uncharted territory to confront, but nevertheless, we're working each day through the holidays, planning, trying to do some work. I mean, we didn't have a big, much of a Christmas because we had anticipated that we would be getting here, and we have been working on it. In terms of digitization, in the way of a reminder, we have gone digital with the COVID-19 vaccination cards. It features a quick response QR code that enables the validation of the information in the card and of persons' vaccination status without violating their right to privacy. It is also accessible by a mobile phone or other electronic devices, and provides for an ease of travel, as its QR code is readable on an international platform. Now, we do note that some persons have been having some experiencing some downtime in the system or difficulties in accessing the system. That was to facilitate some adjustments, optimizing some of the security updates or features. Some persons may have also seen errors in their records captured on the system, and they are advised to follow the procedure to ensure that these records are corrected and their electronic vaccination card has the most up-to-date information. Now, we did say that if you're not techno-savvy, go to your health center, the fixed sites. There are a number of them, over 60 odd across the country. Find the one in your parish or in your community and go sit with them and let them work with you through. You can print or you can download and travel with it. I have downloaded and I'm traveling on my phone with my vaccination card, the QR code. The downtime was necessary, and Mr. Sean Bolton is online, who can give an update or answer any questions, because we needed to strengthen the program. And, you know, those who are in the techno field will understand and appreciate that there are deviants in the technology world who make it their priority to disrupt the normal flow of the efficient use of technology. And, you know, we classify them as cyber hackers and cyber terrorists and cyber attackers, and every system is subject to some of that. And we have adjusted some of the security features in recognition of the risks, if a risk is discerned, whether through an attack, cyber attack, or just through ongoing upgrades and monitoring. And the downtime was an attempt at protecting and strengthening the integrity of the system and to protect the information that is there, which is your personal information. I want to reassure you that so far, up to now, that information is protected, and Mr. Bolton is online. He can speak more on that. So, okay. All right, so I want to just break here for questions. I want to say that we have online the Minister of Education, Dr. Ennis, CMO, of course, and PS, but also Mr. Shane Dallin of the National Health Fund. The National Health Fund did put a release out today as it relates to some management challenges at the NHF. I have been in touch with him as acting chair, and I know some steps have been taken to address the situation, and I wanted him to be here if the need arises beyond the release that was sent out to provide some better clarity on the information, because the board has been mandated to examine, investigate, make some recommendations, and those recommendations are being actively implemented. So if there's a need for elaboration, I will defer to him, at least for now, on the matter. And then we have Mr. Sean Bolton, who is the IT at the ministry, who can address anything for the vaccination card. So Stephen, you want to just go through with any questions, and then we can pick up from there?
Thank you, Minister. Just reminding our media colleagues to use the raised hand feature on Zoom to pose their questions. We're going to begin with Christopher Thomas from the Gleaner. All right, I think Christopher has disappeared. We're going to...
No, I'm here. I couldn't unmute a while ago. Are you all hearing me? Good evening.
Yes, go ahead, please.
Okay, yes. Good evening to you, Dr. Tufton, and to your members. I have two questions here. First things first. There have been concerns raised that there are false negatives that are being arrived at with the antigen COVID tests, and that is being said to be because of poor technique. But in light of what has been happening, especially in the tourism area, with visitors complaining about the methods that they say are being used to reach positives for them when they've been testing previously and getting negative. Are you concerned that they might say that there is some faulty technique or false positives being arrived at? That is one question. And my second question is, there's a set of reports that have come up this afternoon that at the Spanish Town Hospital, that the AC is down at the two main operating theaters there. At the same time, nurses are being required to be present for surgical operations at that time. Is this acceptable, and how is that situation going to be remedied?
I guess that's my question, or both of them, others can come in. All right, so the issue of false negatives, I was contacted by a member of your media house to ask about that issue, and my response, which I note was not carried in a story that was on your front pages today, was the following. There is no foolproof system that gives you 100% accuracy, but there is a level of predictability that comes with some margins of error around the testing method and the different types of testing method. The PCR test, which involves more detail and sensitivity, is the gold standard test of COVID, which is the one that takes longer for a result to be returned, and the more expensive one, if you look at it from a cost perspective. And so the best chance of having an accurate test is through PCR. The antigen next, primarily when you have symptoms, but when you don't, you run a greater risk of false negatives. And then we have introduced the latest technology, which is the home or personal use test. So that's the technology. But the other method is, the other challenge is how the technology is utilized, which is the training. And the PCR, I would say, those who qualify and who administer are the most advanced in terms of their capacity to administer, because it's needed for the technology, the machines and so on. The antigen, not so much, but still require critical training. And the home test, which is the most challenging because it depends on whomever, and because of access, many people will have a chance to use. So you take the swab, you put it at the front of your nose as opposed to further back. You're likely to get a negative, even if you're positive. What we have to do is to be very transparent about that. And why we say to persons, if you have symptoms, seek a more accurate test, even if you get a negative test with one of the less accurate tests. In addition to the personnel, we have systems governed by JANAC, which is the agency under the Ministry of Industry, Investment and Commerce, and the Public Health Lab giving support to ensure that the process flow and the management, how the test is administered, the human component, is done in a way that is consistent and gives the best chance of the best or most accurate result. Where that breaks down is where you will have further issues. Now, I am sure that as you widen the net of more persons administering tests, the probability of more accurate or less of more false positives or false negatives will widen. And so we have to accompany testing with the other methods, mask wearing, symptoms, get a second opinion, that sort of thing. I also would advise that where persons are testing when they are not so authorized to do, because we note that there are some sites or some locations that are advertising tests that are not authorized either by the Public Health Lab or JANAC, and persons unsuspecting maybe are going to access those tests. We can offer no guarantees. And I had a meeting this evening with the team, and I indicated that where it is obvious, because we know, because we can't monitor everybody, we don't always have information, we must say publicly that buyers should beware or aware that these are not authorized sites. I took note of one tweet thread earlier today of a particular entity that was making a comment around their testing. When I inquired, I was told that they were neither approved by JANAC or certainly not by the ministry. And JANAC has a very critical responsibility in terms of the process flow and the human component in terms of technique. So I know it's a long-winded approach because it's a nuanced response that is required. I am sure that the more sites you offer tests at, the more you give individual responsibility, is the more likelihood there is for error. But I would say that based on how we assess the state of COVID in the country, based on our surveillance arrangements, this is now epidemiology with the CMO and the team, I believe and I'm confident that we have a system that monitors the critical points to determine the extent of COVID in the population. So when we give a 40% positivity or a 2.4% reproductive rate, we would have looked critically at the critical points, whether it is through persons turning up in hospitals or through our centennial sites across the country, health centers, or through the PCR systems, private or otherwise. We would discount for some of the antigen because of the margins of error that we're aware of. And we have that formula that comes up with a final position. And for us, in terms of planning and policy and response, we are fairly confident in terms of the numbers. And the historical data shows that in terms of how COVID has gone through the population, both up and down. So I am still confident in our system, but I do appreciate the point that more persons offering tests, particularly those who are not authorized, will mean that we have more false positives. And that's not a good thing. And we need to discourage it and stay away from persons who are not supposed to be doing it. And we will continue to also monitor. Thank you. The one about Spanish Town, Chris, I can't comment. I don't know. I was there yesterday, and I was told that the occupancy level at Spanish Town yesterday was 60% or just under 60%, which I thought was good. Well, the doctors confirmed, one doctor with me, the two doctors, that they were having a lull and they were happy for it. I never inquired about the operating theater, so I don't know. There is a system to deal with these things. I will check with the Regional Health Authority and find out. It wasn't said to me when I was there. And they were quite helpful in terms of administering my vaccine. Thank you.
Thank you very much, Minister. I'm going to go to Kimon Francis from the Gleaner.
Thanks, Stephen. 3 questions, Minister. when will the genome sequencing machine be commissioned into use? Have we confirmed through samples sent overseas, whether to CARFA or the CDC, that Omicron is actually here, the Omicron variant? And if yes, when did we get back those samples? The third one, fewer than 100 Sinopharm vaccines have been administered, doses that is, have been administered or reportedly administered of the 200,000 that we acquired. Is there a strategy being employed to increase uptake?
Whomever she designates, if to just respond to that. Thank you.
Yes. In terms of the genomic sequencing machine, unfortunately, we are not going to be up next week in terms of the training at the university. We were hopeful that for the 10th of January, they would have been ready to start training, and there has been a delay, which we're hopeful that it won't be a delay of more than a week to start the process, and that training process would involve them actually testing samples. So I can't give you a definite date, unfortunately, as to when we would start, but we're hopeful that the delay is not going to be more than a week. In terms of the samples that we have received from external sources, we still have some samples that are outstanding for results, but of the results that we have received, we have not confirmed Omicron in any of those samples. However, we had put out that we had been alerted by the United Kingdom that there were persons who had traveled to Jamaica and on return to the UK were tested and were found to be positive with Omicron. So we do know that there are persons that have passed through the country with Omicron, and it is more than likely that we have more cases in country. And based on the pattern of spread that we are seeing, with a very, very steep rise in the number of cases and the highly transmissible variant that Omicron is, it is more than likely that yes, Omicron is in country and is representing, I would say, a good portion of those cases that we're seeing. However, I just want to remind the public that, we probably still have a considerable amount of Delta virus still in country as well. So we probably have different variants that are circulating. And remember that even though the Omicron virus has been shown to be a less cause a less severe illness, the Delta still, our history shows that we have significant severity of illness in country with the Delta. And so with 80%, almost 80% of the population unvaccinated, it means that we are still quite vulnerable to both the Delta and the Omicron. And so therefore, we need to ensure that we get vaccinated.
Sorry about my usual long-winded self, but I'm the only politician in the room, right? So we tend to be long-winded. We have offered up to date 4 brands of vaccines. And truthfully, while I may have my own personal preference, it's not something I promote. It's my choice. And we continue to subscribe to the view that the best vaccine is the one that is available. And I'm very much, I believe in that, because the alternative is not to take a vaccine and be more vulnerable than those who have taken it. So we do not necessarily have a strategy for any particular brand. Our strategy is geared at promoting vaccine take-up generally. And we urge those who are not to take the vaccine under the guidance, of course, of the clinicians. So if there's a need for a particular booster, for example, Pfizer, then we will advise that that brand is the one should be used for the booster, or a third dose AstraZeneca under the clinical circumstances. So while we appreciate the particular brand, the Sinopharm vaccine, Chinese brand, and we are happy to have it as part of our arsenal of response to the vaccine initiative, and we thank the Chinese for the donation, there is no strategy to promote any particular brand. There never was. It's really a strategy to say, take the vaccine that is available. But we have given a choice, but it's a choice that persons will have to make for themselves when they go to a site where all the vaccines are available.
Thank you very much, Minister. Thank you, CMO. Debbie Ann Wright from the RGI is asking the following questions. She said, what particular observations led the NHF to believe the police should be called in? How many doses were affected? And is the ministry considering giving AstraZeneca boosted shots? And Dr. Tufton, this one is for you. You said the ministry should say which testing sites are not approved. Is MD Link the site you referenced and said was not authorized? And the final question, the ministry had projected a worst case scenario of 1,500 new infections by mid-January. Are we now ahead of that projection?
Okay, so the acting chairman of NHF is on, Mr. Shane Dallin, and he has been charged with convening the board and investigating the issue. So I'm going to defer to him on the two first questions, what led to the police being called in, firstly, and how many vaccines are affected. Just to say on the second question that we're still awaiting word from PAHO, so we're not willing yet to give any particular specifics on some of these vaccines because we need the expert collaboration. But he can certainly give the total number that was in the facility. Mr. Dallin, Chairman, thank you.
Thank you, Minister. The first question is about the observation that would have caused the NHF to call in the police. Having received the management's response and collected all the statements from the persons who were responsible for responding to the temperature excursion, we found preliminary that a wire was cut for the cooling system, and the explanation given as to why the personnel didn't respond in a timely manner was sufficient cause for concern to call in the police and to also request an independent assessment by a firm outside of the organization to protect the integrity of the process and the credibility of the NHF and the storage facility. We need to ensure that the report is clear and anyone who is culpable must be held accountable. And therefore, we felt it necessary that based on what we saw preliminary, required intervention of outside personnel. As it relates to the total number of vaccines that were affected, just over 900,000 were stored in the facility that is in question at the moment.
In terms of the projections, we're not ahead of the projections as yet. We predicted in November that in the peak week we would be seeing about 1,500 to 1,600 cases per day. So we're not ahead of that, and in our most recent projection, we would have projected that by next week, by the middle of week, next week, that would be seeing approximately 1,500 confirmed cases per day. So we're hoping that we will be below the projection, but we're certainly not ahead of the projection at this time. In terms of the AstraZeneca as a booster, certainly we are reviewing the information. We know that there is no new guidance that has come out by the WHO, but we are reviewing also what the other stringent regulatory authorities are doing. And so we're in a process of reviewing the information to see when it is that we will open up for boosters using AstraZeneca.
Thank you. We're going to go to Shaniel Lemmy from the Star.
Good afternoon, all. I have 3 questions, 1 for Minister Williams and 2 for Minister Tufton. Firstly, Minister Williams, you said earlier that 61% of schools have been reopened. What is the percentage and the corresponding number of students and teachers that have returned to the face-to-face modality? And for Minister Tufton, excuse me, is Jamaica still considering the vaccination of children as young as 5? And if so, where are we with that process? And do we have enough Pfizer to make a significant dent in the country? And 3, can your team speak to any changes in the national attitude towards vaccination amid the rise or the emergence of such new variants like Omicron?
Thank you for that. Let me ask Minister Williams to respond to the question that you asked, re-education. Minister?
Sure, thank you. In terms of the number of students, that is data that we have been collecting, so I don't have a number right here now because, as you can understand, it's the first week. We are doing the rotation, meaning some students are in one day and they're out the next and in the next. Many of our students are still using the online modality. We're expecting that by about January 10th or so, we will begin to get a good feel for the number of students as schools begin to get a good rhythm in terms of their students who will be there and who will be out. But those are numbers we will have shortly.
CMO, you want to take on the other question?
I just want to respond in terms of the attitude to vaccination. It really is very disappointing to see the slowing down of the vaccination process. You know, three weeks ago, I went on leave, and when I came back this week and reviewed the data, I was particularly alarmed to see that in the over 60 age group, we didn't seem to have budged at all in terms of vaccination. You know, at this time when we're into this 4th surge, and we're going to be seeing a large number of persons that are going to be infected, and the larger number of 20 to 39 age group that is affected, then certainly they are going to be passing it on to the over 60. And it is crucial that these persons become vaccinated. While we see, the data that is across the world is suggesting that the Omicron is a milder virus in terms of its severity, the severity of illness that it causes, we also have to recognize that a lot of this data is coming out of countries that have a larger portion of their population vaccinated. And vaccination allows you that when you become infected, if you should have a breakthrough infection with COVID, that you would have a milder illness and you don't end up in hospital. I just also want to remind persons that, again, that we also still have Delta circulating in Jamaica. And that certainly is going to be causing a serious illness in persons that are vulnerable. So it's extremely disappointing to recognize that after all the work that we have put in, now that Jamaicans have an option in terms of vaccination, that they're not taking up the vaccine and protecting themselves, and therefore putting us, our health system, and certainly the country at risk again. So this is something that really and truly every young person should be encouraging the older persons and trying to get them out to become vaccinated. And every older person who has been vaccinated should get their friend, family, and other persons in these vulnerable age groups to be vaccinated. So yes, we are seeing a decline in the number of persons coming out. It's extremely disappointing, and we are going to suffer as a result of it when we have so much vaccines available that we're even going to be wasting vaccines. And at the same time, we're wasting lives because people can protect themselves, but they are not doing so. So I really, really want to encourage persons. Don't let all the work that we have put in over the last 2 years go to waste. Get vaccinated and protect yourself. Yes, you can get COVID after vaccination, but you will get a less severe illness. You won't end up on a ventilator, and you won't end up dead. So please go out and get vaccinated.
I just want to say that back to what I had said in support of the CMO, the complacency is worrying. I'm concerned about it. And I really want to encourage us and influencers in the society, stop promoting the mildness of the virus in a manner that could discourage the protection that the country needs and the uptick in the vaccination levels that are necessary. The truth is, the mildness of the virus is maybe in the virus itself, but it's also a function globally of the extent to which COVID has been around. Persons have been infected who don't know because there have been many asymptomatic. So the world and the country, we are building up immunity one way or the other, either through vaccination or through natural means. But the low vaccination rates does place us at a disadvantage and a severe disadvantage. And I would hate to think that we, as a people, are so encouraged by the description around mildness that we get this false sense of security and end up in the hospital or worse. It's not something that we in public health are willing to promote or to support. Thank you. Next.
Thank you, Minister. We're going to go to Jamila Maitland from RJR.
Hi, good evening. To Jamila from the RJR Gleaner Communications Group. I have a question for the Minister of Education. Has the ministry abandoned the 65% vaccination rate for the school population? And what are some of the ways that the ministry in a similar way, incentivize, or the government incentivize the national vaccination program? How are you going about it with schools? And my question for the Minister of Health is, to what extent are you seeing people leaving isolation after receiving a negative test, COVID test result? Is it centered around tourists or citizens? And then even after leaving isolation, does the ministry recommend them going about in the general population, or they still have to complete quarantine?
Minister Williams, you want to take the question on education, please? Thanks. Unmute,
thank you.
Please. Okay.
Right, yes, I just did that. So with regards to the first question about the 65%, if you will recall, some time ago, that was the national target to which we all aspired to get. You just heard the Chief Medical Officer talk about where we are now, which is quite a ways away from that. In the education system, we adopted that target for our high school students as soon as there was enough vaccines in the country. We have seen take up among our high school students at the end of December. Latest figures that we have, we would have seen about 32% of our students who were fully vaccinated, 32%, but that was still a long ways from the 65%. We work hand in hand with the Ministry of Health and Wellness. We take our cues from them, take our mandate. And so, it was decided that the 65% target, in light of where we were in the pandemic, and Dr. Tufton and CMO, you can help me out here, in light of where we are and, in the pandemic, in terms of the percentage fully vaccinated, where we are right now, the 65% might not be a target that we should maintain. And so you would have seen the efforts last term, in terms of getting vaccinations going at our schools. We had well over 250 events in our high schools, and they're continuing, even though that the 65% target is not there, but they're still continuing in schools. The fact that high school students are back in the face-to-face mode, we believe having a vaccination blitz at school while they're there is going to encourage the take-up. So that's where we are. Yes, we can say that for schools, the 32% is ahead of the national average, but it's still far short of where we should be. And we're still going to be encouraging, we're not still going to be, we are. There are several schools that would have done vaccinations this week as well. How are we going about vaccination? Are we incentivizing, or it's primarily been moral suasion? We've held many Zoom sensitization sessions for teachers, school leaders, or parents, to get them on board, to help them to understand what they need to about vaccinations. We've allowed them to ask our health professionals as many questions as they can. I know Dr. Ennis helped us in terms of having many sessions with parents, teachers across our many regions. We work on the ground with the regional health authorities to get the vaccination events, the blitz, up and working in our schools. And we are going to continue to do so, despite not still having that hard and fast rule. But we are really encouraging our students, parents, all who work in the school environment, to really be vaccinated, the first line of defense. Of course, you've seen the pictures where we encourage the mask wearing and observance of all the other COVID-19 protocols that is happening, but we want to see those vaccination numbers increase across the education sector.
Ask the CMO to address the second question, please.
Right. I just want to say what the discharge protocol for in-country as it relates to persons that remain in Jamaica has not changed, in that there is a 10-day isolation period for persons who are confirmed positive, and those persons, there is no test to be released from isolation. It's a symptom-based release. So if you've had 3 asymptomatic days, then at a minimum of 10-day isolation, then you'd be released. If at 10 days you're still symptomatic, you would need to have 3 asymptomatic days. For persons with severe COVID, those that are hospitalized, it's a 14-day isolation period. Now, we have made an allowance for the tourists that are visiting from the US, where the CDC has allowed for a 5-day isolation period, that these persons can opt to do a test and to be, if the test is negative, to be released from isolation. And the thought is that these persons would move straight from the isolated area to the flight to leave the country. So if these persons are going to be staying in Jamaica beyond the 5 days from when they have been isolated, then we would revert to a 10-day isolation period. So they will only get a release if it is that they are going straight to the flight. Now, in terms of take-up, yesterday when I checked, we had about 105 persons in Hanover that were in isolation in hotels, and 5 or 6 persons would have been discharged at day 5. They had a negative. They chose to do a test, and they had a negative test, and they were discharged. I'm not sure if there were others who had done a test and the test was positive, but I know that 5 or 6 persons were discharged at a day 5 negative. For St. James, we had about 140 persons that were in a hotel isolation, and we had no reports of anybody doing a test from St. James. That was yesterday. It probably is still early days in terms of the take-up of doing the test, but persons do have that option of doing the test, and if they have a negative test, to be released so that they can go home.
Thank you very much, Simo. I'm going to go to Stevian Simmons from Nationwide.
Hi, hi. Good evening, Minister Tufton. With what happened, the tampering incident at the NHF, how will that affect our vaccination effort? Because unfortunately, when we see a rise in cases and a rise in hospitalization and deaths, we also see a rush on the vaccination centers. Can you guarantee that we'll have enough vaccine to deal with any rush that may come on the sites? 2, is the ministry aware of any instance where persons who were tested positive for COVID-19 were still allowed on flights to Jamaica? And last question, are we anywhere closer to a national vaccine mandate or a vaccine option, as the Prime Minister calls it?
Okay. The issue of availability of vaccines, I thought I'd addressed in my earlier comments. We do have vaccines in stock, all 4 brands, and are available to offer those across the country. I would love to see a rush, so I probably should say we don't have enough, so hurry up. And maybe I'll even say that, but I'm being jovial, but I really would like to see. We would like to see more take-up. We have about 500,000 or so doses now. We would like to see more persons, and we don't think that we will run out of any of these 4 brands that we have. We do expect to have other shipments coming in. So, the answer to your question, so as not to cause any undue stress for those who are desirous of having the vaccine, to go to a center and get it. If we have a rush, which I desire, I am sure we will find ways to add to the inventory in order to offer more vaccines in the system, and whether it is Pfizer or AstraZeneca or any other. So that's the response.
I just want to say, Minister, just to the members of the population, some persons would have visited vaccine sites between probably Monday and Wednesday, and for AstraZeneca, their second dose of AstraZeneca, and the sites did not have in stock. So all sites presently have in stock now, and so therefore you can return to the vaccination center to get your AstraZeneca vaccine.
And we do expect some shipments during the course of of January, end of January. I'm told that we have a substantial shipment of Pfizer coming in. So I wouldn't worry about it, but I would encourage the rush, as you put it. The issue of I'm going to leave the issue of The second question was about vaccine, right? I can't read my own writing, unfortunately. What was it? No, the mandate was the third. So let me address the mandate, and maybe you can remind me of the second. I think the Prime Minister has been clear on the vaccine mandate issue in terms of the need to encourage, in the first instance, to provide information, to provide access. I think all of those things have been done. And the question is, where do we go from here, given the low take-up? And as you can see, we have gone now to speak to gatherings of vaccinated only, discussions around test or vaccinate. And I think that is likely to become a more dominant feature of the future dispensation. But I would not feel so privileged to speak on behalf of the Cabinet of Jamaica. I know that discussion is ongoing. There is always a review. And, I've ventured out maybe a little far to say I do believe that we should recognize those who are vaccinated, frown on those who are not, and start making some choices, personal choices, company or organizational level choices to require persons who are not to recognize the risk they pose to themselves, to the rest of the society, to businesses or otherwise, and to put in place measures that would encourage take-up in support of those who have already taken up also. So I do believe that with time you will see a more strident position taken. I'm not prepared at this point on my own to say that it will translate to a mandate in the strictest sense. I think that would have to come from a more collective position. But I do believe we need to take a more strident position. I do believe that. What was the second question? Is she still on? Go ahead. What was the second question? No? All right, Stephen, you want to continue?
Patrice from IRFM is asking Mr. Daly to explain what exactly is meant by a breakdown in operations, and if you suspect it's sabotage, and what is the status of the police probe since it's been 2 weeks, and has anyone been sent on leave or suspended pending the outcome of the probe?
Chairman.
Okay, thank you. What is meant by a breakdown is that there's a standard operating procedure that should have kicked in as soon as the alert on the temperature excursion took place. We found that preliminary report suggests that that did not take place. And that is why we felt it necessary to do a more in-depth and detailed analysis of what took place, and to do so with an independent party. As I said before, all the reports that have been gathered, and based on what we have seen, it required both the independent analysis as well as a police investigation to provide a comprehensive report for the Ministry of Health and Wellness as well as to the entire country. And it will guide us in putting additional measures to safeguard and to prevent any recurrence of this incident.
Okay.
Thank you very much. Ricardo Brooks from Nationwide is asking the CMO if what accounts for the increased hospitalization of children from COVID. And he has said the MAJ president had warned that Omicron appeared to be affecting children in other countries where the variant has been detected. Can you confirm if data from PAHO or WHO confirms this? And if yes, what does that mean for the resumption of face-to-face classes? He's asking the minister, people are asking about the daily testing capacity at public testing sites, if this is actually a government policy to have a cap on the number of tests done at public testing sites daily.
Okay, so I pointed out in the presentation that we are not seeing an increase proportionately in that more children in terms of the proportion of children that are affected. Meaning that if it was 1% of cases that were in the 0 to 19 age group 6 months ago, it's still 1% of cases. But because we're seeing a much more transmissible variant, there are a larger number of persons that are affected, and so therefore that 1% is a larger number. So we're seeing a larger number of admissions of children to hospital. In terms of why it is, I think that we would need to spend a little bit more time looking at what is the reason why children are being more affected in other countries. As I said, that is not bearing out for us here in Jamaica, and I'm not sure at all that is being borne out in the region. We had a regional CMOs meeting today, and that was not stated. But certainly we recognize that it is in the international press and in the literature that they are seeing more children, but we have not seen that. Proportionately, it's the same percentage of children, but because the numbers are larger, then the actual number is greater.
What was the question? Was there a question? Yes, I saw in the media where my colleague in Parliament, opposition spokesperson on health, my friend, member guy, suggested that somehow we had a cap on the number of tests done in the public facilities. I certainly don't know that that is the case. In fact, I am told that that is not the case. We test based on a protocol and a medical assessment that is administered to the individuals who visit that location. I'm not suggesting that maybe at some point you may run out of test kits at a particular location. Maybe you would have, but there is no quota on any numbers of tests in any particular location, except working hours, when places open and close, and the number of kits that may be available, and the personnel that's there on site, and so on. Those are critical variables that go into testing. But beyond that, no, there's no quota.
Thank you very much. Chanel Spence from GIS is asking, in light of the fourth wave, is there any consideration for younger students who are not yet eligible to receive vaccinations to be exempt from attending face-to-face classes?
Is that for me or for the Minister? Minister Williams, can you, or is it for health? Let me give an opinion and then you can come in, Minister Williams, since it's health related. We recognize the fourth wave and the risks that are posed, but as has been said for the record, we believe that getting our children out into classroom to face the teachers and to restore a sense of normality to their learning process and to their mental state has far more advantages than the risk associated with the virus. And there are systems that have been put in place, protocols to give protection against those risks. And we continue to believe that at all levels. And as the Minister has said, those systems are in fact in place, and we will continue to collaborate around those. So I would not see a reason to keep anybody out except where a school may take a decision to rotate or to have partial face-to-face because of particular circumstances, which the Minister can elaborate on. Minister?
I'm totally aligned with what you are saying, Minister Tufton. We are encouraging face-to-face because of the benefits of having our children in that environment. Teachers would be there, would observe them to know if anything has been happening to them. They're able to get access to psychosocial sessions. They're seeing their friends again, and they're engaging. So we believe that's the environment for them to be in. We are doing it as safely as we can. And I talked earlier on about all the protocols that are being observed in our schools, the very stringent requirement for our schools to be inspected and to be rated satisfactory before they are allowed to be opened. Having said that, we still continue with all the modalities that we had available to us. So online still continues, or learning kits or lessons are still being broadcast on radio and air, and on television. And our schools are working with parents to accommodate as best as they can, but our overriding desire is for our students to be back in the face-to-face environment.
Thank you very much, Minister. We're going to go to Zara Burton.
Good evening, everybody. My questions are for Dr. Ennis and also for the CMO. The questions, Dr. Ennis, how many post-vaccination deaths are we up to now, regardless of cause? And can you speak to the exact date of the report you're pulling from when you deliver the information? Also, something I've been asking for a few months now and still haven't gotten, I'm going to ask it again. What is the breakdown of serious adverse events by age? Then also, CMO, I know that this is preliminary, but maybe it's for the PS, but Merck and Pfizer, I believe both of them were approved at the FDA level, the drugs that cut the rate of hospitalization and death. Are there any moves in the same way that there was a COVAX facility to get vaccines into the country? Are there any moves to try to get hold of that when they become more widely available? And also monoclonal antibodies, those kinds of drugs to treat COVID cases in the early stages of the virus.
Right. So Dr. Ennis is not on, and she will have the details of the first part of the question. Now, in terms of the treatments, Zara, I know you're well read, so you would have seen the health alert that the CDC had put out on the 31st of December, where it spoke about the different treatment regimens. And we recognize that things are constantly changing. Certainly, we would see that for the monoclonal antibodies, the bamlanivimab, etesivimab, the casirivimab, imdevimab, that they have not been found to be effective against the Omicron virus. And so, therefore, the only one that seems to be a little bit effective now is sotrovimab, which is in extremely short supply. From our perspective, it's not so easy for us to knee-jerk and get these items in as soon as they become available. Countries that they are marketed in, they tend to hold on to these items. And even in the US now, there are, you have to go through hoops to get the sotrovimab because it is in such short supply. In terms of the antiviral medications, we would have seen a lot of different things come on, and so we note that there are two, the Paxlovid and the molnupiravir, that are there, and the latter, it only has been shown to decrease the severe outcomes by about 30%, the Paxlovid certainly is more effective, and certainly we will see what the clinical team suggests. We would have to explore things in terms of cost, etc., to see, because these drugs have to be started within a certain period of time and used in a certain type of patient. And so, we would have to look at those things in order to determine whether the cost benefit, the type of patient that we're going to be able to use it in, the time to treatment, all of those things have to be considered. Certainly we keep a track on these things, and there are some of these. The molnupiravir is certainly not recommended in pregnancy, in breastfeeding women, and in children. And then we have other drugs that were mentioned in that report that we continue to monitor. The thing is that with the variants changing and the different kind of responses, you have to be cautious how you invest in these drugs. I mean, we certainly saw what happened with remdesivir last year, where at one point studies show that it was effective, and then we invested heavily in it at that time, and then a couple of weeks later we would have seen the report from WHO that is not found to be any more effective than other treatments. So it is something that we consider, and we are guided by certainly what is happening in other stringent regulatory authorities, what it is that they bring on board, and also what is available to us and the requests and needs of our physicians here.
Thank you very much, CMO. We're going to go to our final two questions. Cassius Watson from Jamaica Social.
Good evening, folks. I have two questions, one to the CMO first. CMO, clearly this virus has, especially what seems to be Omicron, is moving like in a massive wave across the country. And many people who have been fully vaccinated have been forced or have come across the virus again, and some are showing many minor symptoms. Your thoughts on regarding boosters for those who would be close to or considering to go and get their third shot? What next for them, especially seeing that many have been asked to just stay and isolate? What next for them? And my question to the minister is, I just looked at some stats that suggest that Jamaica is now at just over 20%, and for us to move to 30%, it would take another 320 days at the current rate of vaccination. Just assess, how do you feel to know that with all the battles that you're fighting, you're literally looking up a very steep slope? What does this mean for your ministry and your direction going forward? Thank you.
In terms of the boosters, yes, certainly we are seeing that persons who would have had the vaccine, or even persons who have been infected in the past with other strains of COVID, that they are becoming infected by presumably Omicron at this time.
Decided verdict out there as to the extent of that immunity from persons who we seek and the normality that we desire over time. And I'm not projecting a 360 or 320 days for that. I'm saying that we need to get there well within this year, and we need to hopefully do it the way that puts us least at risk, which is through vaccination. But otherwise, we will get there through other means, which may not be as desirable. And this is why we continue to encourage the population to seek the most desirable option, because that option is available to them, which is to get vaccinated. Thank you.
Thank you, Minister. The final question is from Nika Lewis from CVM TV.
Hello. Hi, good evening. Happy New Year, everybody. Okay, so this one is possibly on the heels of that question. I was trying to get this answer for a while now. The WHO has been talking about a 70% target vaccination rate for all countries by July 2022,
to the extent of that
and that they'll be providing some support to these countries who are on board to getting the population vaccinated at that rate. How likely is it for Jamaica to get to the 70% target by July 2022? And also, has there been any resources or pledges from the WHO to this end?
And the normality that we desire over time. And I'm not projecting a 360 or 320 days for that support. I'm saying that we need to get there well within this year.
I can speak
and we need to likelihood, hopefully, do it the way that puts us an assumption at risk, that which is through vaccination. The desire is to get, but otherwise, as many Jamaicans as possible who qualify for vaccination, other means, which may not be as desirable. I think even though we had said why we continue to started on this projection to seek the most desirable 2 years ago, a 65% target. That option is available. I'm not so sure that that is a target that we should linger
final
too
question
much
is
on,
from Nika Lewis from
because
CVM
truth
TV.
is, those who are not vaccinated are clearly at a risk. So that other 35%, for
Hi,
example,
good evening.
theoretically
Happy
speaking,
New Year, everybody. Okay,
we
so
wouldn't want them
this
to be
one
exposed
is
unnecessarily,
possibly on
and
the
so we would
heels of
not
that
want to stop
question.
until
I
they
was
have an
trying to get
opportunity.
this answer for a while now.
To the
The
extent that they
WHO has been
qualify
talking
by
about a
age or
70%
otherwise.
target
So
vaccination
we are
rate
pressing
for all
ahead by
countries by
offering
July
the
2022.
opportunity to get vaccinated. We are pressing ahead by providing the motivation, the information, the access, the vaccines. And as I said earlier, I certainly would like to see a more bullish attempt, a more assertive attempt in the future to encourage take-up. I'm not focused on WHO targets in this instance. I'm focusing on trying to get Jamaicans to get vaccinated. And the WHO would have more information than I as it relates to the world and the countries of the world. There are some countries that are far lower than us in terms of vaccination numbers, despite our numbers that are relatively low. I'm sure the WHO has their own information that can suggest how they set their targets. But for me and for us, I think as a country we need to focus on Jamaica in this instance and to push for more persons to take up. CMO, you want to comment further?
Yes, I would really just want to take the opportunity to recognize the work of the PAHO and the WHO in terms of the support that it has given to Jamaica in terms of the vaccination program. We started out with the COVAX facility, which was a paid situation where we would pay for vaccines, but outside of that, the PAHO WHO has interceded on our behalf in several situations and have lobbied for us, and we have brought several thousands of vaccines into country that has been afforded through this means of having other countries donate vaccines to Jamaica. And so I'm not sure of any other specific support in terms of what you're referring to, But I think the tremendous support that we have been given so far is really worthy of every Jamaican's gratitude, because it really has been a lot. Thank you.
I think that's it. Just ask Simo, could you just comment our position finally on vaccines for 5 to 11-year-olds? And then the Minister will give his closing remarks.
Our priority at this time certainly remains at the vaccination of the most vulnerable in the population. So that has always been our first priority and remain our first priority. In terms of the vaccination for the children, though, we do not presently have. It's a different formulation of the Pfizer vaccine, and we are negotiating to see if we will be able to receive any of that vaccine, but we presently do not have that vaccine available. But again, to say that the most vulnerable is the greatest priority in terms of getting those persons vaccinated. And if we can get those numbers up, we would be in a very good position.
Quickly on that, without detaining us too much longer, this is a fairly long or lengthy COVID conversation, that the 5 years, the 12 and under, as CMO said, is a different formulation, but importantly also, it is not available on the market. My understanding is that stocks would have been bought up or controlled by the more industrialized countries, and one would have to negotiate with the manufacturer through those entities that have already secured stocks in order to access at this point. I'm sure it will change in the future. So I have gotten calls from persons who have said, why are we not offering? And out of genuine concerns, most likely for their children or grandchildren, it is not that we can go on the market and purchase, because if we could, chances are we probably would have up to now. We also have to deal not just with the science of the efficacy and effectiveness, but also with availability. And that has always been a feature for a significant period of the COVID response, which we classify as vaccine diplomacy or vaccine hoarding, as the case may be. In this instance, the vaccines for 12 and under is not on the market for sale, which poses an additional challenge, even while we negotiate and we assess. All right, that's it. Okay, so we're gonna quickly wrap up. I want to just use the opportunity firstly to thank my ministerial colleague, Minister Favour Williams, for coming on and spending a long time with us and hopefully responding to any queries satisfactory to the questions that have been asked. Shane Dallin, Acting Chair, who I am sure will provide better particulars in the days to come around the issues at the NHF. I want to recognize the NHF, if I may, because the NHF remains one of the more efficient agencies of the Ministry of Health and Wellness. They have done well. They have received several awards for good governance. We can't take that away from them. We have to recognize them for it. But if there are challenges, we have to solve those challenges. And what we want to do is to be very, very transparent about any response. And the board, I think, has been tackling the issue, and I appreciate that, supported by the clinicians around the efficacy of the vaccines that were compromised. And those vaccines are not being offered to the populace at this point unless we get all clear that they can be. I want to thank Mr. Bolton. Nobody asked the question about the vaccine digital card, but you can go to your health center if you can't download online. I've seen many people commenting online about not being able to get through. If you can't, call the 8881 LUM number or visit a fixed site. Then you can get the help that you need, because we don't, doing it online and the response online is not going to be as efficient. And we understand if you're having issues, but just use one of the channels that are available. Thanks to CMO and PS. Just to close, where we should have started by wishing all online a happy new year, challenging new year nevertheless, happy 2022. 2021 has been a tough year. Hope we got some rest. We are up to the task. We want to remain hopeful and to promote hope that 2022 will be a better year for the COVID response and the success around overcoming COVID-19. Our theme is to live with COVID, which means protocols and vaccination, not shutdowns. It's a dynamic situation, so we pivot as necessary. Partnerships are important, and we look forward to the private sector and other stakeholders being a part of the process. And we will continue in public health to provide information, access, opportunity, motivation, guidance to the COVID response. But it all boils down ultimately to personal responsibility. And so we urge you to recognize your role in this response as we seek to restore some sense of normality to a country and to a people that have really made significant sacrifices to date to ward against the ill effects of COVID. So thank you very much. Have a good night. And we will continue to dialogue to provide you with all the clarity that you deserve. Thank you.
Digital vaccination cards are here. The Ministry of Health and Wellness will be updating physical vaccination cards, making them more secure and convenient. Here's how to get your digital vaccination card. Step 1. Visit vaccert.moh.gov.jm. Step 2. Enter your mobile number to receive your one-time password or OTP. Step 3. Check your mobile for the OTP and enter it in the space provided. Step 4. Check if the information on your certificate is correct. If the information is correct, you can then click to download the certificate to your mobile device or print a physical copy. If the information needs to be updated, click on the link and upload a picture of your vaccination card, front and inside pages, and a government-issued ID or letter from a Justice of the Peace. In 72 hours, visit vaccert.moh.gov.jm and follow the instructions outlined. Digital vaccination cards are here. Get your vaccination card today. Get vaccinated. Get back to life.